evening to everybody that has joined us this morning, and we're just waiting for a few more people to get on board to join the meeting before we will start. So I hope that everybody is able to hear me all right, and if you do encounter any difficulties, then you can always send us a chat message, which would be a text that you could send to the host, and we will try to rectify any technical issues that you might encounter. Also, as we have said, we would like to make this a very interactive affair. So if at any point in time you would like to say something, then you could use the raise hand feature that you have, and we would be able to accommodate you into the stream, and then you'd be able to interact with the presenter. So we're just waiting for a few more people to join in, and then we should be good to start with the webinar. And thank you very much to everybody that has joined us promptly on time. Just expecting a few more people to join us. In the meantime, also, I'd like to thank everybody for your interest in this particular webinar. In fact, this is the first of a webinar of this kind that we have organized in the past. Most of you have been participants in our workshops, and those have been face-to-face so far. But this is when we're trying out this online facility, and we hope that it is going to be suitable for our purpose, so that in future we can continue to deliver more workshops of this nature and webinars and other interactive sessions where we'd be able to join in with a lot of people from all over the country and get some of those conversations happening on a whole range of issues that have emerged as a consequence of the pandemic that is currently sweeping the world, the COVID-19 pandemic, which is also wreaking havoc on Fiji, has really disrupted people's lives, having a huge impact on the economy, creating a lot of confusion relating to people's constitutional rights as well. And the courts and different protagonists in the justice system having different interpretations of what some of those rights are, especially in extraordinary times as the one that we're going through. And therefore, in such a context, it is absolutely critical that we also garner the views of the people and civil society organizations. Of course, always attempt to ensure that the voice of the common people is heard, it is considered, and the people in true democratic fashion are allowed opportunities and avenues to have their say. So if you will notice from the program that was sent to you, the very first session that we had was to be on COVID-19, and then subsequently there were sessions on the economic impact. COVID-19 is not just a health crisis, it is also an economic crisis. And in fact, in some context, there are prevalent views that the economic impact of the pandemic may be more costly than the actual human cost of it or the health impact of it. And Fiji, given our economy, the fact that we have a very vulnerable economy, undiversified, we don't have physical reserves, we have been hit very hard like other small island developing states. And the government is, of course, struggling to meet the needs of the people at a time like this, especially when they lack the financial capacity to do so. There's a lot of discussion happening in relation to the use of superannuation funds to fund COVID-19 relief, to provide support to businesses and laid-off workers and others, which generally is, in democracies expected of the state to be doing. So we also need to get some of those conversations happening relating to the economics of it, the economic impact of COVID-19. There have been a number of commentaries in the mainstream media and social media as well, economic commentaries, but most of these commentaries have been quite partisan in nature because the people that have been making those commentaries have generally been politicians, or they have been economists that are known to be aligned to certain political interests. So we don't really have had that sort of independent and non-partisan economic analysis that has been done. And we have, to this end, tried to do this. And apart from some of the primary research that we have done, some of the commentaries that we have published in the newspaper, we have also been very fortunate to secure the participation of a very prominent economist, somebody who is truly an expert as far as macroeconomic policies and analysis and of Fiji is concerned, and he also has that development orientation, which is very important element right now, because as you know, economic growth in a lot of countries has taken a huge hit. So we are anticipating declines, negative economic growth, or essentially economic declines, maybe for the current fiscal year and perhaps for next year as well. So it would be very interesting to get an independent view of this. And we have with us today Dr. Roop Singh, the head of School of Economics. And since he has arrived, he will be the one that would be going first, because he has other commitments after this, and so we're going to be reshuffling the program a little bit. So Dr. Roop Singh is a very accomplished economist. He's a very accomplished researcher, somebody that has written very prolifically about Fiji and the region, very respected in his discipline, and we are indeed very fortunate to have him. And as I've said, he's somebody that is absolutely untainted. He is very independent and very non-partisan in his analysis. So I'd like to invite Dr. Roop Singh to provide his presentation that would be on the economic impact of COVID-19 on Fiji.
Thank you for this morning, ladies and gentlemen. It's my pleasure to be here. I'm from the University of the South Pacific, and I currently look after the School of Economics. The work that I'll be presenting to you this morning is our research based on what we think would happen to the economy given the COVID-19 situation. We had done a paper on this, and it's currently submitted to a journal. So the title of the paper is COVID-19 and the Tourism Industry in the Small and Vulnerable Economy of Fiji. What we have done is that we have done a CGE. CGE is the Computable General Equilibrium Model. It's a model of the entire economy, looking at all the industries and sectors in totality. So we've tried to simulate the model to see the impact of that on the economy. So before I go into those technical details, let me give a very brief background of how this thing is eventuating in this economy now. As you know, we have a number of entities and industries being affected by the crisis. And given the nature in which industries and sectors are connected, we just cannot say that it's just one industry or one sector which is massively or negatively impacted. I think by the nature of the crisis, it's very obvious that many more industries are connected to this, and therefore such analysis has to be very holistic. So what I'm presenting to you this morning is a snapshot of what we thought would have happened in the economy. So we will be presenting different scenarios of how things may eventuate, given what's happening globally. Now, I think it's important also to realize that while this crisis is not a big hit on our health status as yet, things may be different when we reopen our borders later down the line. But it has a lot of impact on our economy, and therefore the economic costs are huge. So let me go to that analysis table. Once we get in there, I'll be able to give you a more detailed picture of what we're looking at. So I'm skipping a number of pages in this paper. We'll leave a copy of this paper with Nilesh and them, and they will be able to give you details of this as we proceed. The paper has a lot of technical details, as I've mentioned, so I don't expect you to know all those technical bits, but we'll try to explain as much as we can on what the model predicts the outcomes likely to be. This is our joint work from a number of colleagues in the university and IDB. The model that we're simulating here is called the USP Fiji CGE model, and this is the one that we did last year. We revised the model and the database to reflect the economy as of mid of 2018. And as you know, the economic situation, the elasticities and others do not change much in terms of a year or two. So what we did was we updated the input-output table. This table basically explains where the source of the inputs are, source of products are, and who is the other party to it in terms of the demand and outcomes. Then we designed the new input-output table for Fiji, based on which we determined the structure of the economy. All of these details are explained in this particular paper. So I'm going to skip all these technical calculus and formulas for you. I'm just going to go straight to the table of results. So in this paper, we're looking at how the economy may be impacted, where the conduit of the impact is largely the tourism sector. And I think, as you will realize, this sector is seriously being impacted. So I've got a few scenarios for that. There are two tables, in fact. One is more aggregate, the other one is more sectoral. So this is the one which is the aggregate table. And the scenarios are as such that we have three different simulations. Simulation 1 in the first column, then simulation 2 and 3. And simulation 4 and 5, these look at the government's initiatives to provide some cushioning impact. So simulation 4, which is in this column here, broadly talks about what may happen if government provides a 10% additional expenditure, which they do, or which they did in 2018-2019 budget. And then the last column looks at if this stimulus were doubled. So this is like a 20% impact on spending. So we have alternative scenarios as such that there is like a hit on the tourism sector, three different scenarios for that, scenario 1, 2, and 3, and two different ways in which government is trying to deal with the crisis by additional spending. So scenario 1 is like a 25% reduction in visitor arrivals, so tourism numbers, and scenario 2 is 50%, scenario 3 is 75%. So if you put that in terms of months, you could say 3 months, 6 months, 9 months. So the scenario that we potentially would be looking at in terms of Fiji would be between 6 to 9 months of the impact on the tourism industry. What is more important for us to realize is how this will impact the economy. If the crisis were all over in terms of 3 months, then that would have been sort of relatively best case situation, in which case the real GDP would have just declined by about 2.6%. But we all know that that is not the situation. So we may hit somewhere between a negative 4.9% GDP growth to a negative 6.77% GDP growth this year, given whether it'll be a 6-month case or a 9-month case. In other words, 50% decline or 75% decline. 6.77% negative growth was realized in 1987 in that kind of political crisis. So certain macro, social, and other economic impact, you may want to contextualize that from that 1987 situation. I'm not talking about the political situation. What I'm talking about here is the social, the impact on the economy, consumption, people's lives, and the others, because the growth rate then was a negative, very close to 6.77. So if we see a prolong of this crisis to about 9 months, starting from March to the 9 months to follow, we're looking at a negative 6.77% decline. You could easily say negative 6.8. There are other guys who have predicted even much more serious declines. Thankfully, I think at this point in time, we cannot really predict what the real growth would be because of the nature of this crisis. But having said that, a nine-month decline is a kind of a good proxy to what we're expecting, then this table shows you what would happen to various macroeconomic aggregates. Look at GDP growth, negative 6.8, you can say. Other things are household consumption doesn't show much change, government spending to raise. We look at export volumes. Export volumes are expected to decline by about 30%, which is a huge reduction. Imports expected to fall by about 14%. Aggregate revenue from all indirect taxes of government, about 27%. And the other thing which is of importance to us is employment. In totality, employment growth would be negative, about negative 8%. And of course, returns, there's an index called the rate of return to profit or to assets, which is profits, to fall by about 26%. This is huge decline. Some good signs are that the consumer expenditure prices, which we call the CPI, to fall by about 11.5 or 12%, which will be a bit relieving. But the terms of trade will worsen for Fiji by 20%. This is quite huge. So all in all, you're seeing at something like 6.8% decline, given this situation, with about 30% max fall in export volume and about 26% decline in the rate of return index. This is huge impact. Now, the actual nature of the impact is very hard to be determined at this point in time. So should we have a second wave when we open up the borders, then I'm pretty sure numbers would change a lot, and there'll be huge, other huge negative declines also. Now that's on the economy itself, major aggregates. Then we look at the different sectors, and these are indicated here in this particular table too. Individual sectors like agriculture, mining, manufacturing, electricity, and all others are given there, about 19 of such sectors. We'll leave the paper for you to get the details of this. It's very hard for me to read through this small table here. But I think the bigger sector, the sectors which will have a big hit would be transport and storage, accommodation, food services, which looks at tourism itself, and administrative and sport activities, also entertainment, arts, and recreation. and other activities. These are based on the national accounts construct of the different sectors. So once you get the full paper to read, you will see that things are not looking very good at this point in time. But of course, there are positive things which are eventuating also. I think the government is knowing what's going to happen. There are various other agencies like ADB, World Bank, IMF, all of them are giving some signals, and of course the government has its own research team, the Ministry of Economy and others, who are looking into similar things, and I'm pretty sure they know exactly how things may outturn. So they are actually providing some stimulus to the economy at this point in time. However, many of these things are not enough to what we may end up seeing towards the end of the year. So having said that, we require additional stimulus into the economy, largely and potentially from international donors, because given the difficult situation that we all are in, including the government, I think the government is doing a lot that many other governments around the world are doing. The Pacific region as a whole is quite safe, as you already know. I think because Fiji is more connected to international economies, we have got into this difficult situation. However, the good thing at this point is that the number of such positive cases are very small and they are contained. However, things, as I said, could be quite difficult towards the end of the year. So this paper gives you an idea of what happens in the economy should tourism numbers change by so much, because I think the bigger impact on the economy will come from the tourism and of course retail sales and others. So please feel free to read through the paper and come back to us if you have any comments or issues. We'll be happy to give you more details if you needed to know on individual sectors or industries. We can do some simulations for you using the model to explain how things may eventuate for your own individual industry or sector. And this information will be quite useful for your own planning and policy. So with that, I thank you very much for listening and would open up for discussion.
Can you hear me? Hello?
Yes, we can.
This is first time using Zoom, and I'd like to take the first opportunity because I've got a clinic to run. Actually, I run 3 clinics across Nindi, Suva, and Singatoka. Right now, I'm in Namak. I'm a GP, I'm a doctor, and I'm also a final year law student. So I've got a clinic full of patients. So I just would like to thank you for your presentation. Very informative, but nothing new, because we in the GP sector, we already know how grim the situation really is, because we are feeling it. Okay, and I'd like every participant on this forum to know that it has not been easy for us. I'd like everyone to take note of this one. This very important fact, that when the coronavirus hit Fiji, we were given no support, none whatsoever. We were not provided any masks. We were not provided any gloves or any PPEs, protective personal equipment. We were left on our own to salvage and to get whatever we could or get our hands on. At one point we were scrambling. You know, there were some doctors who were locked down in Lotoka, and their clinics running in Bao. People were stuck, right? Their clinics to run. They couldn't get out. That's another thing. How, at one point we were scrambling to get our PPEs from gas companies, from construction companies. Like because there were some who were I'd say freaking out, because everyone wanted masks and everything. At one point we were wearing those those almost useless dust masks. At one point I told my patient, hey, go and get cut up a bra and use a female bra on your face. What will these things happen. But I'd like everyone to know that first up, that even though we did oppose the ministry, we were left in the dark, and we made do with what we had, but the thing is, there is no law in Fiji which actually empowers or puts the responsibility on the government of the day, on the Ministry of Health, to supply these masks and gloves, to supply essential equipment to GPs and other allied medical professionals. With the Ministry of Health, as apart from us GPs, and also there are the phlebotomists in breeding centers. You know, there are other private sphere nurses. There are many other professions, but we were really let down. Okay, that's point one. Point two, the information blockade. Okay, fine. They give us so and so patient, 18 patients in the hospital. And for example, how many have recovered and whatnot. Okay, but the thing is, they're not telling us the actual clinical details. What was their temperatures like? All the finer prints, the history, how did they contract the virus, and all this. It's very what we hear is from the news, from the tabloid. That's a mockery. There should be an open dialogue of communication. Nothing happened of that nature. All throughout, we were in the dark. Okay, we did strike up some Bible forum. I'm also managing a Bible forum, and we have a lot of doctors there. There was a Ministry of Health individual. I cannot take his name for privacy purposes, but even then, at some point, he just left. He just vanished. So we were not getting information. We as doctors, this is a very sad thing. That as we represent a very big amount of doctors in Fiji, the physical general practitioners, and then we were left in the dark. How do you expect a country to move ahead in its medical fraternity and its medical recuperation, its medical recovery, when you're leaving us? We are the frontline workers, mind you. Take it to effect. We see the people who, they are doctors in the GOPD. We also mostly run SGOPD clinics. And when we are not provided with PPs, when we are not provided with information on what is happening, what is actually happening in the country, then how do you expect us to battle this virus? Well, that's point number two. And also, there are also such things as standard operating protocols, which are non-existent before the virus came in. Now they're in existence. And still there's no partnership from the government with the private sphere, so that we cannot develop these rules and regulations how to combat this virus and the patient load and everything. Okay, fine, there are some clinics who are doing it, but this is operating from scratch, from whatever WHO has put on their website, or some country in Zimbabwe or Africa is doing it. So we're just following their footsteps, but nothing from the government or whatsoever. This the same thing. The information blockade, the communication, is nothing there. And also, as there are many doctors who are struggling. And in the past, we had put forth a proposition of a public-private partnership. Now, that is not taking place. There is never ever taken place. But now, when the need is there, there's no, again, communication. There's no dialogue. Also, the tax guys show up and ask us to pay our taxes when we're already struggling. We've got mortgages to pay, we've got car loans to pay. So we've been given there's been some tax exemptions, but they should be giving us, because we are putting our lives on the line and exposing ourselves, and they don't, they should have at least realized that, at some point we might get the virus, we might fall sick. And what happens to our clinics? Who takes care of that? Any insurance of that? Business insurance? Nothing of that nature, and whatever the government has put forward in their budget. And also life insurance coverage for us. Whatever, if we was as frontline workers. I'm sitting in my clinic right now. Any COVID could walk in right now. I have to put on a mask, but for this purpose, I'm not wearing a mask right now. But we have fears, and also we don't have any particular life insurance coverage for ourselves and our families in case of this pandemic, because we are aware that abroad there are some insurance companies who are not paying their clients, their the money is because in the insurance contracts pandemics are not covered. So these are all things that are there. Also, there are some doctors who are willing to come into locum practice. Locum says in the private doctor going into government practice and helping out, trying to get and make that extra dollar. But no, not everyone is lucky as me and as engineers, because the day the virus dropped into Fiji, I have this foresight. So I happened to open 2 other clinics, just as a security, not only because my wife is also a doctor, but as a security that what if things are not very well in Singapore. So I have to do something about me, my children, and my finances, And but I'm also a part of the what do you call the Chamber of Commerce in Singatoka. I'm actually the secretary. The president is Dr. Salikam Gobind. He's not available for comment, but the Singatoka is very bad. The only people who are smiling in Singatoka is the farmers. Because the farmers very well know they can do their farming and they can feed their tummy, they can feed their neighbor's tummy, and they can also make a living out of it. But all the hotel workers, I I'm a little bit notorious for sick shits, but I see a regular clientele of hotel workers. They break their backs working in the hotels. But now I don't even lift my sick sheet book because they're not coming in to be seen.
I do. We noted some of the things that you've said. I think, this thing has happened and, everyone was caught napping. And I do, agree that with some of your views, but please do also note that the medical profession, including you guys, have been, been in the front and doing a lot of work for that. I think we all appraise, your efforts, including the government's. But there are few things to be done also. We all are learning as we moving on. And I think we'll be better prepared next time, I guess. Are there any others who have got comments or questions?
I have one. Hello?
Go ahead, Mr. Nawal. Yeah.
All right. I just started a company a few months ago, and I went to 2 different banks in Suva City for unsecured loans. Both times I wasn't told that I'm going to be denied even without them looking at my papers because I don't have a security. I was told I was denied because they had nothing to give me. Now, I'm not one to believe Facebook rumors, but I'm sure you know which one I'm talking about, and it's making sense to me. Would you happen to have any information for me to clarify this?
Nawal, thank you for your question. I'm also in the same boat, my friend. Banks are very tight these days, as you know, because of the risks. But I'm pretty sure there are a number of banks to shop from. So probably if you search around, you should get something which is more conducive to what you want. I also note the government is implementing support to small micro enterprise. I think from early of next month. So please get in touch with them also. At this point in time, my friend Noel, it's hard on everybody. So I think we'll have to be much more creative in terms of how we approach the banks and what we really want to do with the finances that we may be able to obtain. A lot of people are into a difficult situation as well.
Thank you. That answers my question.
Okay, anyone else has anything to ask or contribute?
Thank you, sir, for your presentation. I'm just going to just ask you for your economic opinion about the future of young people in terms of the employment, and what do you predict in the long run will happen to those that are just graduated or looking for employment during this COVID-19, and what is the future like, especially for young people?
Thank you, my friend. I guess at this point in time, it's very tricky to suggest that there would be some scope for decent employment. But moving in the future, if you look at it in, say, 2 to 3 years down the line, I think we would be in a better position then. Because, human beings are quite intelligent group of people, I should say, and they will sooner or later find a way to get around this crisis. So once we are out of this, then of course when things get back to normalcy, there will be scope in many of the industries and sectors, and certain other sectors, new ones, will eventuate, which we have not really seen eventuating now or in the past. So there will be scope. I don't think we should, think as if this is the doomsday and there's nothing ahead in the future for us. We're going to be more creative and help each other. Of course, look at what the government's doing and trying to see how best we can deal with this situation. Okay, I guess I don't see any other person raising their hands or whatever for questions. There is one more. Marida, I guess. Yes, Marida? Unmute. Unmute? Okay.
Can you hear me?
Yes, we can hear you now.
Thank you for your presentation, sir. My question would be, if you were the Minister of Economy, what would you do differently from the current Minister of Economy to help the Fijian citizens cope with the financial crisis that we're currently facing from coronavirus?
Marida, a very technical question that you posed to me. Look, before this crisis actually eventuated in Fiji, there's lots of experience of other countries and experience of other countries' policies that they had been implementing. So good thing on us is that we can see through what others had been doing, and we could have tailored it down to suit our economy better. So in that way, we don't really have to reinvent the wheel. That's one. Now, putting myself into the Honorable Minister's perspective and trying to answer your question, see, the way that the government looks at this is very different from the way that we look at it. We are more individuals. We look at our own families, and therefore we make conclusions. The government is an entity which looks at the entire economy, everyone in totality. So the way in which they would respond or suggest to respond to the crisis may be very different to the way that we think would work the best. The government has got a lot of resources in terms of people, skills, knowledge, technology, as well as we are also there to provide support to the government in terms of analysis as such. So I think the government's response as they are may not be exactly as what you think would be, because they have a lot of agents and of course individuals and organizations to look at together. It's very different. Policy making is very different to what we think would best suit the economy. So I depend a lot on the government's ability to solicit all this different information and analysis which development partners, donor agencies, universities and others are providing, and then base their decisions on that. Currently, as you can see, the government is coming up with measures to increase the flow of funds and investment funds in the economy also. And that will provide some support. Moving ahead, I think much more of policies like that will have to come into place.
Okay, Dr. Singh, in relation to, Fiji is going to be, the Minister for Economy is going to be delivering a new budget in about a month's time. And as you've talked about, there's very limited fiscal capacity that the government has at this point in time, with the fact that government revenue has drastically declined as well. Some say it is going to be around even less than 2 billion for the upcoming fiscal year. So do you think that the government can continue to sustain expenditure at the current levels, especially given that the government has so far been committed to paying civil servants and not reducing their pay, and others that are funded by the state? So do you think the government can continue to sustain expenditure at the current levels?
Well, when we look at it, my friend Nilesh, times are difficult, we know that. and therefore the government's resources in terms of tax revenue is declining. If you look at our own analysis, it shows about a 27 to 30% reduction in the indirect tax collections, which is a huge hit on their finances. However, the government would be able to secure some funding from IDB and other development partners if they are willing to support Fiji, and I think they have been very much willing to support our small economy. Whether the government will be able to maintain their current spending, I think given the situation, the government would be reducing expenditure on certain areas which are currently not required or not prioritized. But I think the government would be, in the next budget, trying to work out which are the priority sectors and industries, health being one, employment, activity, others, and they will prioritize that. And having said that, you will see a lot of reshuffle of spending from one to another, given the situation at hand. So we may have a very good budget, but I think the next budget will be all about sustaining the economy, because currently it's quite a difficult task for such a small economy to deal with this crisis, which has a lot of impact on our economy. There is another question, my friend, from Roderick.
I just wanted to follow up with what Nilesh had stated about the budget. For us as concerned citizens, what do you think will be the long-term effect with the massive amount of loans that Fiji has made in the COVID-19 scenario, and how are we going to repay back all those loans once this COVID-19 has passed? How is Fiji going to economically survive all the loan payments post COVID-19? So that's my question.
Okay, my friend, you know that if you're talking about the loans are dictated by their own terms, and the government is being very careful in selecting those which has got lower interest rates, between 2 to 3%. And some of our own analysis show that that kind of loans is more sustainable, so that gives government some fiscal space. However, with the grants and support from other international community, I think the government would be able to deal with this payments of loans and all that. But as the economy recovers, the economy itself will generate funding and incomes for the government to do so. And that's I think what the government is currently doing. It's trying to get the economy back on track. Although the task is quite hard, but they're doing a lot. And as we move ahead in the future, if things become better, the economy will generate funds, and that will help government deal with some of these loans. As far as their grants, they are less worrisome. And if these are aid, then of course, it's more or less tied to any other thing here. Okay, Alianeta has something to ask or suggest to us?
Yes, Bulavinaka, can you hear me?
Yes, we can hear you properly.
Okay, thank you. We're all talking about our current situation, and it's just, I guess we all know about the initiative on Facebook, the Barter for Better Fiji, yeah, those kind of initiatives. We're going back to, those systems where, like, bartering system and trading and all those stuff. Yeah? For the current situation where people are being laid off and there's, no continuous source of income, those, that system, that barter system, it helps, individuals or their families at homes and in our different communities. But my question is, do you encourage that kind of system to be brought back into into the economy for the better of in the bigger picture, not just families or individuals, but do you encourage that for the nation for during our current situation or maybe after?
Alinieta, thank you for your question on the barter system. You may recall that before this modern day, exchange, which uses money, this system was already there. And people used to trade with the barter system. But the barter system has its own disadvantages. And let me highlight that to you. And after that, probably you will see that why we may not want such a system, or no one would want such a system. It failed. Currently, it's working because people really do not have a lot of cash to buy goods and services. So one good is traded for the other, and that is helping. So currently it is. But moving ahead, I don't think that's a right thing to do. First, the barter system creates what we call a double coincidence of wants, which is, first, you have to find out or to find a person who actually needs the goods or the services that you offer for what they want. And that can have a lot of transaction costs, can take time, can make you run around a lot. So potentially that is not a very good thing. The second issue with the barter system is that there is no way in which you will be able to determine what is the best value for the product or services that you're offering in the barter. For example, if you tell me that, well, you have a bundle of dalo and you needed, say, a bag of rice, and I have rice. So we chatted over the whatever medium that we're using, say Facebook. And I promise that I will give you rice for the dalo, fine. But when you evaluate the value of dalo and that of rice, and you take the difference of the two, either you or me would be gaining. So someone is gaining at the expense of somebody else. And that is not a very good idea. So, for these reasons, although the current barter system seems to be working in our economy in some places, there is no point of making it a huge, large-scale, macro kind of thing. So one last question. Naidu, is it?
So my previous was more of a statement, information to you guys. My second one is a question. The question is, there is we were told 25,000 people unemployed from tourism sector. Now the figure is more like 40,000. They could be easily somewhere close to 100,000 indirectly or directly, a group of people who have been affected by this pandemic, okay? Primarily from the tourism industry and its associated industries, okay? Now, does anyone in this country have any idea how to re-employ this big amount, this bulk of our workforce? Now, you cannot just simply say, oh, we'll open our borders. Our two primary tourist factories, Australia and New Zealand, will start sending their people over. But the thing is, when those people, I know there's some people who are really aching to come to Fiji, okay? Because the thing is, the tourists will not go to China. They will not go to America. They will not go to South America. Forget Europe. Asia Pacific is the more prime destination, okay? And the other thing is that, so the thing is, they will only come if they have money. They are also suffering as we are suffering here in Fiji. Our people are also suffering. So, but has the government or anyone on this forum have any idea how to re-employ if in case the tourism doesn't kickstart again? The worst of the worst scenario. Now, I was thinking one day on my own, the one thing we have is land. We have pristine land. We have a lot of ocean. We can put these people in the farms. We can ask them to farm, get the farmer to do something for them. He gets his cut. They get that cut. The surplus we can export. Now, there's nothing else how we can just suddenly start re-employing these people. And the other thing I want to let this forum know is, for example, New Zealand has done almost close to 100,000 plus COVID-19 tests. The we call it PCR tests, not those flimsy point of care rapid tests. We won't accept those tests, okay? So the PCR test, they have done almost, I would say they're approaching 200,000 tests. And they've got a couple of number of cases. But New Zealand is a population of roughly less than 5 million. Less than 5 million people, or approx 200,000, less than a million. So how can we actually be calling ourselves at one point COVID-free? And the other thing to realize is, what if, I asked this question on Facebook to some of this same question, which also Nilesh, I put across to Nilesh in the past in Facebook, and also to our Viva forums in our medical fraternities. What if an Aussie tourist or a Kiwi guy comes to Fiji, falls sick. He was COVID negative, but he got the virus from Fiji because of our under screening, our under surveillance, our under COVID positive patient to lock down the whole country. Remember that. But my main question is, does anyone have any idea how to re-employ 40,000 and counting people in this country? Apart from tourism, I'd say don't put your money on tourism right now. Think something else. Thank you.
Thank you, Mr. Naidu. Let me provide some guidelines to the answers properly you are looking at. See, we don't know when this pandemic would be over. We are hopeful that it'll be over by November or December, whatever. So if things move in that direction, we should not be worrying about reshuffling of workers from here to there, at least in the long term. But in the short term, I'm pretty sure people are already moving from the tourism sector into others. Being at home for about 3-4 weeks, straight after the 13th of March, we would have actually found alternative jobs. Highly unlikely that you will see families or people capable of working may not want to work because the situation is quite difficult. Now, where is the work available at this point in time? That's a big question, because there are other sectors which are open for activity and trade within the economy, not much outside. But it's very difficult to find jobs. We all know that. People have started to do their own little work at home, or do it for yourself kind of activities, or grow your own, whatever they're doing. But I think these are only short-term temporary things that they are engaged in. We all are hopeful that once things are okay, we can get back to our normal businesses. And that's one. Second would be our other sectors. And I think many times we've been saying that we should not depend too much on tourism because of a number of things. One, its impact on the economy is not as profound as what many analysis will show you. We find that its retention, the tourism retention, is much around 40 to 50% of every dollar that comes in. So that actually meant that we ought to have diversified. We have done to some extent, but I think there is a lot of room for diversification moving on from the crisis. So once things become much more normalized, I think everybody would have learned that we just cannot depend too much on this tourism industry. We need to diversify into others. However, the rates of returns on other industries have also fallen a lot. So probably that is what's stopping people from diversifying into certain other activities. But I'm pretty sure once we use technology and are much more innovative, we can do far better. So thanks, Mr. Naidu, for those questions. As I suggested to you, I'm running late a bit. I'll welcome if you have questions, please send me emails. My email is singh_r@usp.ac.fj. It's also indicated in our paper. I'll give a copy of the paper to Nilesh as we go from here, and of course you can extract that. You can also search me, USP webpage, or even Google search. I should be available. So we hope to continue dialoguing with you and discussing some of these things. Thank you very much.
As I mentioned earlier on, we have reshuffled the program a little bit, and the very first session was supposed to be a session on COVID-19. So we're supposed to discuss, the pandemic, the nature of the pandemic, and other pertinent information relating to the pandemic that is currently sweeping the world. So I'm going to take everybody through that session. But of course, we would want to make this a very interactive affair. So if at any point in time you have a question, you can raise your hand. We're going to accommodate you right there and then. Also, it would be interesting. I mean, even if you have comments, that you'd like to articulate, then you could do so at any point in time. So that is how we intend to conduct this next session. Otherwise, it can potentially become a boring affair with me doing a majority of the talking. First, we're going to look at what actually are coronaviruses. I know that in some countries, they are actually referring to COVID-19 as coronavirus. In some countries like India, I've seen them call the pandemic corona. But, coronaviruses is a very large family of viruses. So COVID-19 is one of the many viruses that are part of the coronavirus family. And they form a large family of viruses that are known to cause illness ranging from the common cold to more severe diseases. So these are illnesses of the respiratory system, essentially. And the most severe ones have been the Middle East respiratory syndrome, or the MERS, and the severe acute respiratory syndrome, or SARS, which were pandemics that struck in the last and the present decade. Coronaviruses are essentially zoonotic viruses. This means that they're viruses that originally were hosted by animals. And then subsequently, these viruses evolved and they were able to jump species. So there was a spillover event, and then they were able to actually jump from one species to another. And in the case of the COVID-19, this spillover event is suspected to have happened around November or December of last year in Wuhan, China. So, current research suggests that the spillover event happened when the jump was made from bats to humans. But we do not really know for certain at this point in time whether there was an intermediate host involved as well in that spillover event. So essentially, coronaviruses, initially they were not able to lodge onto human tissue. So they could not be hosted by human beings. So they were not able to affect or infect human beings. They were only viable in animals, but later on they evolved and they managed to jump species, meaning that they developed the adaptive features to be able to lodge onto human hosts. And there's a lot of conspiracy theories also that the virus has been genetically engineered as well. And what I'd like to say to that is that the current research suggests that this has not been the case, meaning that the research has revealed that the sort of evolution that has happened within the particular coronavirus that has been able to infect humans, COVID-19, it has been something that can be attributed to the immune system. So, in any particular host, when there's a foreign antigen, foreign organism like a virus that is able to lodge, then there's a reaction from our immune system. And subsequently, every living being has got the capacity to be able to evolve in order to survive. So viruses, even though they're very small, they don't even have DNAs, this particular coronavirus, they're essentially RNA viruses. They have managed to evolve and being able to now survive in human hosts. Types of human coronaviruses. So, there are 7 types. So there are a number of coronaviruses, but there are 7 that are currently known to be able to infect people. So the common ones are, those 4 that you see on your screens. 229E-NL63 OC43 HKU1. So these are the common human coronaviruses, meaning in most of these are relatively benign in the sense that they're only able to cause, relatively minor infections like the common cold, influenza, and others that are mostly seasonal in nature. And these have been there for quite some time. In fact, the very first coronavirus and that could be hosted in a human being was identified in the mid-1960s. And that is when the first case of coronavirus human infection was first discovered, and subsequently the coronavirus was identified. The coronavirus actually gets its name from the crown-like spikes that are there on the surface. So these crown-like spikes are very similar to the corona. Corona, in fact, is the aura of plasma that surrounds the sun. So that's where it gets its name from. So if you have seen a graphical representation of a coronavirus, you would see that it has got spikes. And those spikes are the ones that are actually able to lodge onto ACE2 receptor cells, mostly in the lungs of human beings. And coronaviruses have this outer layer which is made up of lipids, meaning fats, and that actually makes it quite susceptible in the sense that lipids can be easily destabilized by agents such as soap. So that's why it is always suggested that you need to continue to wash your hands with soap and water. And soap and alcohol are the two things that are known to destabilize lipids. And subsequently, when the epidermal or the outer layer is gone, then the virus breaks down. So as I've said, the common human viruses that are there that have been infecting humans for at least 4, 5, or 6 decades, those are the 4 ones, and they cause those relatively mild infections like a common cold, flu, etc. that people get. And these are seasonal mostly. So, mostly in the cold season in Fiji, people get these coronavirus flus. Okay, Dr. Ashang, I suppose you wanted to say something.
Your notes are okay. The things are okay. Your presentation.
Okay.
Thank you for the but let me clarify on that. Sorry, I'm charging my phone and everything. Yeah, but this what happened? Initially, we were thinking this coronavirus, when it affects you, apart from the coryza, which comprises of the watery nose, watery eyes, coughing, running nose, and all that, the actual pathological impact of the coronavirus is more pneumonic issues, more affects your lungs. So instead of thinking more that it was causing a what we call like your clear blowout pneumonia, now that has been overrun by the idea that coronavirus, not only does it cause a type of a pneumonia condition, which is basically inflammation of your lungs, infection of your lungs, it also causes a thrombosis, a multifaceted inflammation of your lungs. So that comprises of an infection, an inflammatory response, and thrombosis, plus the very alveoli, the actual the level at which the gas exchange happens in the lungs. The alveoli collapse. So when the alveoli collapse, there's a expulsion of fluid, a fluid into the alveoli and the capillary membranes. So that's why people have breathing problems. They cannot exchange gas inside the lungs. Your radiator fails in a way, So that's why the countries, the hospitals, they require ventilators. What the ventilators do is they try and pump in air into your lungs. So they keep that oxygen going across the membranes, even though the membrane has failed. So that's the actual basis. But how many ventilators do we have in Fiji? You know that? how many are on their way? So, you know, if I say the numbers.
Definitely, that's a good point. But on the other hand, you know, if you look at the prognosis for the people that have been on ventilators in other countries, only about 19% of the people eventually recover. They're able to have a fulfilling or, you know, a life worth living after they get off the ventilator. So, you know, this is a very destructive virus in the sort of lasting structural damage that it causes to the lower respiratory tract in the organs.
But the data coming in from Europe especially. Now the thing is, Europe is a very highly developed country, and they have a very highly developed social system. And now these Europeans, mostly you'll notice that they're elderly groups. They're already having diabetes, pressure. They already have heart conditions. They're always heavy smokers and all this. You know, a lot of other factors are there. And they have a very different socio-economical condition there, and a very different environment compared to our Pacific. Now, there are a lot of factors and there's a lot of data. And, you know, in time to come, you know, the thing with our scientific model is we see the situation, we get the data, so it takes time to get this and you know, process it and get to a resolution. So things are very fresh right now, and you know, we're handling something that is very new. Although it just passes off as an ordinary flu, but then it causes death and mortality at the end. And in the same respect, there's also some talk of lasting effects on the human body, you know, even to the extent of to the brain. They're lasting, and they're also suspecting some behavioral changes in people who happen to have recovered from COVID-19. So it's a very, very novel. It's something very new. So, you know, like it's something that we would never come across in our medical literature and in experience.
That's right, precisely. Thank you, Dr. Ashank. And as I was saying, so these are the 7 coronaviruses that are known to infect people. These 4 have been pretty common, and they weren't really thought to be too much of a problem because they weren't causing too many fatalities until, you know, we got the first major outbreak of a new kind of coronavirus, which was the MERS coronavirus that causes the Middle East respiratory syndrome. And then came the Sars coronavirus. So this was a beta coronavirus again that caused that severe acute respiratory syndrome outbreak. And then the latest one, of course, that we have, the official name is SARS coronavirus 2, or the novel coronavirus that causes the 2019 COVID-19 disease. And this is also a beta coronavirus. So the major outbreaks have been, as I mentioned, the SARS virus, which struck in 2003, and there were 8,096 confirmed cases of this virus, and there were 774 deaths that occurred as a result of the 2003 SARS coronavirus outbreak. So essentially this meant that the case fatality rate was 9.2% for that particular epidemic. And then in 2012, there was a new kind of coronavirus that was again detected, and it also caused a major outbreak. This time there were 2,494 confirmed cases. Most of these were in the Middle East, and there were 858 deaths that resulted from the MERS coronavirus, which meant that the case fatality rate was 37%. So out of all the coronaviruses, the novel coronavirus outbreaks that we have had, MERS was the most severe, or the virus was the most dangerous in terms of its ability to cause fatalities or deaths. And In fact, that also became one of the reasons why the MERS coronavirus outbreak ended, because if a particular virus is too lethal, that means it is not really able to spread to more hosts, because it is able to very quickly kill uh, the person, the host, and subsequently, it is not really able to spread that quickly. The 2019 coronavirus, COVID-19, initially it was called novel coronavirus 19, and now the official name that has been given by the Taxonomy Council of Virus for Diseases or Viruses is SARS Coronavirus 2. Initially, so we no longer naming viruses on geographical locations, or on etc., like we used to do in the past, like in the case of MERS or the Spanish flu. So the old health organization just called it 2019 novel coronavirus, and then subsequently the official name was given as SARS coronavirus 2, because when the virus was isolated and it was examined, it was found that it was very similar to the 2003 SARS coronavirus. So the genetic material had a 70% match with the SARS coronavirus, which essentially meant that it could not be considered a separate species of the virus. So that's why it is called SARS coronavirus 2. And as of 24th May 2020, and so that's the last I checked, there have been 5.4 million confirmed cases. So if you compare with the other outbreaks, the number of confirmed cases by far is the highest, and that's why it has now been called a pandemic instead of just being called an epidemic. And there have been over 344,000 deaths as of yesterday due to COVID-19. The case fatality rate at the moment is 6.36%. So if you compare with the other two coronaviruses that struck before, the case fatality rate is relatively low. Although if you consider the number of closed cases, then the case fatality rate would increase to 13%. So more than 2 million people have recovered so far, and 344,000 people have succumbed to the virus. So that means there's a 13% case fatality rate out of all the closed cases so far. So anybody has any question? You understand, the background in relation to coronavirus, what it is, and the types of or the history of the outbreaks of the virus of coronaviruses that we have so far had. Right. Audio on. Okay. All right. So welcome back. Is it online?
Yeah, we can hear
Screen.
you.
Okay. All right. Screen. All right. So, in fact, the factor which determines how fast a particular coronavirus or any other virus for that matter is able to spread is its reproductive rate, the rate at which it is able to spread or transmit to other susceptible individuals within the population. And in the case of COVID-19, this is quite high. So even though this the R naught or the reproductive rate is actually attributable to a number of factors. For instance, how committed people are to social or physical distancing, and other behavioral changes, and the containment policies that are in place by the health authorities and national governments. But in the case of COVID-19, it is still quite high, and it is estimated to be somewhere between 1.4 to 3.9. So and this is something that is constantly changing, because as I've said, the virus is novel. The COVID-19 is a novel coronavirus. It is a new coronavirus, and we need at least 2-3 years for us to have adequate information about the nature of this virus, its reproductive rate, and the way that it is able to transmit. But given the rate at which the epidemic is spreading, we definitely know that it is a highly infectious virus, and it is able to in fact spread in a number of ways, which is why it has got such a high R naught value. So if you look at the symptoms, if you consider what are some of the symptoms of COVID-19, most of you of course would be familiar with this by now. Fever, cough, fatigue, and shortness of breath. So these are the common symptoms that people experience, and some people might also experience other symptoms like runny or stuffy nose, sore throat, headache, muscle aches and pains, diarrhea, chills, repeated shaking to go along with the chills, and loss of taste or smell. So and this is actually a problematic element about COVID-19. If you look at the symptoms, these are very common symptoms, and most of these symptoms are very similar to symptoms for other common diseases that we have. That are out there. For instance, the common cold, and even some allergic reactions. You're going to have the same symptoms. So that is proving to be a big problem, because it is very difficult for anybody to diagnose who actually has COVID-19 unless you do a test, unless you carry out a reliable test, you cannot conclusively diagnose that somebody has COVID-19. So the sort of screening that was done by our health authorities, in many ways you could say that it was perhaps an exercise in futility, because you cannot really diagnose people to be having COVID-19 or to be, carriers of the virus with the thermometer or, with other simple checks that were carried out. Of course, it can give an indication if people are likely to have the disease, but it definitely is not conclusive in any way. And the other problematic element about this particular coronavirus is the fact that it is able to spread in a very secretive, in a very stealth way, meaning that for a number of people, they might be carrying this virus, and they can actually, go the entire course of the disease without exhibiting any symptoms. So there have been known cases of people that have been carriers of the virus, and they have been shedding viral loads, but then did not show any symptoms for the entire course of the disease. And initially it was thought that for all cases, symptoms show up within 2 weeks. And so that's why, we had that 14 days mandatory quarantine periods and others. But then there have been cases which are now showing that people are going well beyond 14 days without showing any symptoms. And that is why Fijian authorities have actually increased the quarantine period to 28 days. But one of the problematic elements again is that research is pointing towards the fact that if you're carrying the virus, then the maximum peak period that you have, or the peak period that you have for shedding the viral load, is from 14 to 11 days. And the unfortunate thing is that during that period, most people are not going to have any symptoms. So you could be carrying out that you could be carrying the virus, and from the 4th day to the 11th day, that is the maximum, that is the peak period for shedding viral loads. And so wherever you're going, surfaces that you're touching, you're actually shedding the virus without knowing it. And then other susceptible individuals are of course would be catching the virus from you. Okay, the tests that have currently been developed and are in use to diagnose cases of COVID-19, and I think Dr. Shank Naidu has briefly mentioned the different tests, and he actually talked about the PCR, or the polymerase chain reaction testing. That is the most popular form of testing that is used, and I would say the most reliable test to diagnose COVID-19 cases. So one of the main reasons this test is so popular is because of the high specificity rate. So it is very specific in identifying the novel coronavirus or COVID-19, and it tests directly for the virus. And the disadvantage with the PCR is that it takes a day to provide results, although there have been variants developed of this particular test which purport to give results in less time, couple of hours, 2-3 hours, but some of those are yet to be approved and adequately tested. So normally it takes about a day to provide results, and this is quite a costly test in that it can only be conducted by trained staff and it also requires laboratories and special testing kits to be conducted. So this is the most popular test that is being used by different health authorities around the world, and it is the most reliable test. The other form of testing that has been developed is antibody testing. So essentially, this relies on the fact that once an individual has a particular infection, then the body creates antibodies to fight that particular infection. So once that happens, then you have that particular antibody. So, this kind of test actually tests to see the presence of COVID-19 antibodies in individuals. And one of the things about this test is that it cannot really detect early cases of infection, because it takes a certain length of time before the body is able to develop antibodies to the infection. The advantages of this antibody testing is that it is cheaper to administer and it is able to give results in 20 to 30 minutes. But the drawbacks are that it is less accurate, and the other advantage we could say is that it does not really need trained staff or labs to be conducted. And many countries are in fact considering this type of testing, including UK, the US, mainly because this can identify people within the population that have already contracted the virus and who have a certain level of immunity. At this point in time, it is believed, or perhaps we could say it is hoped, that once you get the COVID-19 infection, then you become immune to it, at least for a certain period of time. We do not really know if that immunity is lasting. If the immunity is not lasting, then that presents a lot of complications for viable vaccines in future, because you need that immunity to be able to be lasting for a period of time for vaccines to work. And so, many countries are hoping that eventually they'd be able to test all members of their population for antibodies, and those that actually have antibodies, COVID-19 antibodies, could then be allowed to go about with their everyday lives, and some of those restrictions that are there can then be gradually lifted. So that is the hope, and we still have yet to see whether this is going to work. Okay, so we're now going to look at the treatments that are there. Well, at the moment, there is no approved treatment, as most of you know, which is why people are so scared of COVID-19. No vaccines, no treatments. But there are these are some of the treatments that are currently in development, and a lot of these treatments are actually repurposed drugs, meaning that these are drugs that have been there, existing drugs that have been repurposed, mostly antiviral drugs, and these are being tested. So remdesivir, this is one of the most promising drugs. It is in fact a repurposed drug. It was initially developed for the Ebola infection, but not used. And then the company, I think the name of the company is Gilead, and they're trying to conduct clinical trials to test the efficacy of remdesivir against the COVID-19 virus. So the clinical trials are happening in different parts of the world, and maybe by the end of this month we will have some data that will show the efficacy or otherwise of this particular repurposed drug, which is remdesivir. And then there are in fact three classes of drugs, treatment approaches. So you have the inhibitors of viral RNA synthesis or antiviral drugs, and then you have antiviral entry inhibitors. So this actually prevent the virus from being able to lodge onto receptor cells or tissues, and these are also being developed. And then you also have immunomodulators and other immune therapies. So immune therapies is essentially being able to ensure that people develop some sort of an immunity to the virus. And these are also being developed at the moment, but most of this will take a lot of time, maybe a couple of years, because they need to go through an extensive clinical trial before they can be proven to be effective, proven to have efficacy, and then be considered safe. And during this time, there's a lot of processes that are involved, such as adjusting the doses, and then then having these double-blinded clinical trials, use of controls and placebos, and so forth, and subsequently the collection of data and analysis of it. And once there is some sort of a concrete evidence that the drug is indeed effective, then there's this other process of government approval that it needs to go through. So you have Food and Drug Administration authorities and other approving agencies that are there in various jurisdictions that eventually approve whether the drug is safe and suitable for mass administration. And then it doesn't really end there, because then you need to go and mass produce some of those drugs, and that also takes time. But of course, our best bet, and we're quite hopeful. I think we're quite optimistic. The world is very optimistic that very soon we're going to have vaccines, and vaccines are currently being developed in many parts of the world, by different groups, scientists, pharmaceutical companies, by universities, by government agencies, and as of now there are about 159 vaccine candidates that are currently in development. So this is some of the most promising or some of the most advanced vaccines that are currently in development, and as you will see that for most of this, the timeline is still quite some time away. So the earliest that we can see a vaccine that can be approved would be December 2020, and then others that are anticipated to be approved as late as 2023. So these are phase 2. Or these vaccines are currently in phase 2 of development. So some of you might be wondering why it takes so long to develop and approve vaccines. And a lot of people are getting quite impatient also in this regard, that okay, vaccines have been developed, why can't they be administered? Right, so you need to realize that usually vaccine development takes 5 to 10 years. But in the case of COVID-19, we have been able to develop a vaccine in relatively short time. Mostly because, there have been work on developing vaccines when the SARS outbreak happened. And some of these vaccines have been repurposed for COVID-19, which is one of the reasons why it has that particular phase has taken place rapidly. And also we need to acknowledge the efforts of the Chinese scientists that were quickly able to isolate the COVID-19 virus and they were quickly able to make this available to other researchers over the world, all over the world, for them to work on developing vaccines. So most of these vaccine candidates, as you see, or quite a lot of these are in phase 1 and phase 2. So for phase 1 essentially is isolating the virus, growing it, studying it, and then developing the vaccine. So a number of these vaccines have been developed, but the other phases, which are phase 2 and 3, they take a longer period of time. So what actually happens in phase 2 is that a group of people, it might be about 20 people that are then selected, and then they're given a dose of this vaccine, and these are healthy people that are selected, and then they are monitored. So usually this particular phase needs about 1 year, but in the case of COVID-19, this process or this particular phase has been hurried as well. So phase 2 is going to take place over a course of 2 or 3 months. The other thing that I forgot about phase 1, during the phase 1 period, you isolate the virus, then you develop the vaccine, and then it is administered to lab rats and other organisms just to see that they are actually safe to be administered on living beings. And then in the second phase, which is phase 2, you have healthy individuals in a population that are then selected, and then they are given a dosage or a dose of this particular vaccine, and then they are then they are observed. So in the case of COVID-19, as I've said, this period is taking place fairly rapidly, and the other thing that happens in the second phase is that the dosage is adjusted. So when the time comes for phase 3, the researchers already have a good idea of the sort of dosage or dose that ought to be administered to the clinical trial subjects. And what actually happens during this process is the clinical trials is that it is a randomized clinical trial, meaning that it is double-blinded and randomized. Double-blinded means that neither the researchers nor the subjects of the clinical trials know whether they have been given the vaccine or they have been given a placebo. And why this is important is because if people do know that that they have been given the vaccine, then they tend to become much more reckless perhaps in their behaviors, and so that doesn't really give an actual indication of the preventive effect of the vaccine. So in the third phase, you have people that are essentially, you have two sets of people, and you'll have more than 1,000 people that would be participating in the phase 3 clinical trials, and these people are randomly given the vaccine and a control or a placebo, and then they are of course released to go on about their everyday lives. And in the normal course of their lives, they are in fact also exposed to the infection, and then data is collected to see whether the vaccine has been effective in preventing infections. And very interestingly, there's a group of people. There's this particular person in the US, I forgot the name, but he's collecting people to who can actually become volunteers in the phase 2 and who are willing to deliberately expose themselves to the virus. So this is an effort to actually shorten the time needed for phase 3 trials. Right? But this has actually not been approved yet by the American authorities. But this guy has managed to enlist, I think, more than 1,000 willing participants. Most of these are healthy individuals who are willing to take a dose of the vaccine candidate, and they're willing to deliberately expose themselves to the COVID-19 virus, in order to ensure that the time that is required for the development of that particular of a vaccine can be shortened. So after the phase 3 is completed, it doesn't really end there, because then, all these researchers that have conducted these trials, they need to give all their data to the government, to the agency that will eventually approve the vaccine. So that particular agency, maybe the FDA, is going to look at all the data, and they're going to take about 2 or 3 months to go through the data to see if there's an actual efficacy that a vaccine has, and then they approve that particular vaccine. So once that happens, it doesn't really end there, because then that particular company will then begin to get all the raw materials in for mass producing the vaccine. So that can take another 6 months. And once that is done, then, initially there would be a limited number of vaccines that would be produced. And then the moral dilemma is going to come in. So you have a limited number of vaccines. Who do you administer it to? Right? And subsequently, only when there is sufficient number of vaccine developed to vaccinate about 7 billion people, then only will it actually become accessible to common people, especially in third world countries like Fiji. So you're looking at realistically a time frame of about 2-3 years before the virus or before a vaccine can become available for mass administration in a country like Fiji. So that is still a very long way off. And then, one of the other complications that we have there is just, in order to encourage private investment into vaccine development, the US FDA had actually said that they're going to respect patents, which essentially means that if a particular company, a private company, is able to develop a vaccine which is approved, they're going to have a patent on this. So if that is the case, then you can imagine what would be the price like for the first set of vaccines, maybe $500,000 each. So only the very rich would initially be able to access the vaccine. Okay, so that was about the vaccine, and we'll now come to Fiji cases. How has Fiji been impacted by the COVID-19 pandemic so far? And most of you, of course, would have these stats from March until May. I think the first case was detected around mid-March. We had about 18 confirmed cases, and out of which 15 people have recovered, and there are currently 3 active cases that we have. And one of the interesting things and a very positive thing about Fiji is that so far we do not have any fatalities or deaths due to COVID-19, even though some of the people that were infected were quite susceptible and there are elderly people that were infected, and but a good number of those, majority by far, have recovered, and only 3 active cases remain so far. But that was just the first wave, and I think there's a lot of evidence when we consider the other epidemics that have occurred. There's usually a second and third wave, and if we see the behavior of people in Fiji, I think it is hugely problematic, because people have become quite laissez-faire, they've become quite reckless. I don't really see people practicing good practices like physical distancing and minimizing social gathering, or greeting people while maintaining their distances and so forth. So I think if there is going to be a second wave of cases, then we're going to be very sorry, because we didn't really adhere to a lot of advice. But we hope that it is not going to happen. In the research that has been done so far, there is some evidence that is emerging that shows that there's a correlation between the viability of the virus and the temperature and humidity levels. So Fiji is now going into its colder season, so we're going to have lower temperatures, we're going to have less humidity, and I think that is problematic, because COVID-19 has been seen to thrive in places where there is lower temperatures and there is less humidity. So I think we really need to brace up. We cannot really afford to become complacent, because complacency is going to really cost us a lot. As you know, and Dr. Ashank has been emphasizing this point, our healthcare facilities do not really have the capacity to be treating a huge number of patients all at once. We don't have sufficient testing kits. We have only done about 1,300 tests. These are PCR tests. So we cannot say with that degree of certainty that we are COVID-19 free, because we have not really tested enough people. Maybe if we randomly carried out 1,000 more tests and we return all negative results, then we could be more certain about some of these cases. But that unfortunately has not been the case. So we cannot afford to become complacent. We cannot be too confident that we have managed to eradicate the virus in Fiji. And Dr. Singh earlier this morning talked about the economic impact. We cannot really afford to have another drastic the lockdown and restriction on business, because currently the Fijian economy is actually sustained by local business activity. The domestic sectors of the economy is what is currently keeping the economy afloat. Tourism income is dried up, so we can't really afford to have our local demand and local retail sector also stop operating. And it is absolutely critical that we do not have another wave of cases, because we can ill afford it. All right, so that's the presentation that I had. And now we're going to take questions. And as I've said, we can also have a bit of dialogue and discussion, which can also happen amongst participants. So Dr. Ashank, I see you raising your hand. Can you end the... Okay, all right. Can you please say that again?
About Yudesh? Hello?
Yes, we
Hello,
can hear
Yudesh?
you now.
Yeah, you talked about viral growth. Now you can't actually grow viruses. Like, for example, for growing like bacteria, okay? If you wanted to grow TB bacteria, you've got a medium for that and all that. But for virus, it's very hard to grow viruses in a culture and try and cultivate it. So that's another delay for getting your vaccine, okay? So when, like for example, taking HIV, okay? HIV has been around. HIV has been around for ages, and we still don't have a vaccine for HIV. There may be, we don't know about it. Some, all these big pharma, they screw us around with us all the time. But getting a vaccine, I won't be having such high hopes for a coronavirus vaccine anytime soon. I don't want to give people hopes that we're gonna have vaccine just anytime around the corner. But no, it has to be more pessimistic in this situation rather than be optimistic, because then a virus, a vaccine comes out, they try it on people, and then the virus. The thing is, the vaccine will only work so as long COVID-19 keeps its genome profile. Now, if this COVID-19 if starts evolving, the vaccine that was created initially will not work. That's why I don't have a vaccine for dengue. That's why I don't have a vaccine for HIV, because they keep on evolving. So that's why there's another reason why not to have high hopes, because it might not work on the long run. Now, if it does work, praise to God. And another thing about, you talked about Fiji behavior. The thing is, look at Spain. You look at Spain. Spain is what you call, they've been one of the worst hit countries in Europe, okay? And the opposition parties are going in, the far right opposition parties are going in the cars, people, the supporters are going in the car, on the roads, they're protesting, maintaining social distancing. Because why they are protesting and why they want the restriction, the economical restrictions, physical restrictions to be lifted is because the economy is crumbling. People are suffering. They don't have money. They have to pay their bills. They have to fill their tummies. They provide for their families. So the thing is, countries are giving up. Now, if you're saying that Fiji behavior, people in Fiji are not adhering to social distancing rules, well, I don't blame them, because people are just giving up now. See, there's no option. People are looking for money. There's no money. Soon there'll be no food. So, it's a very dire consequence. And the thing is, I don't blame the Spanish for half the country wanting to open up the country. Even they do realize, even if they do lift the restrictions, more will fall sick, more will die. But they're willing to take that risk. Now, this one thing, not opening up, and then going on then economic burnouts, that, like on the long term, the people will die anyway, face it, okay? You open up the restaurants and pubs and let people in, people will die. If you don't open up, people will still die, because if they will not die of the virus, they will die of starvation. They will die of hunger or mental illness, or they will suffer in the long run. At some point, people will think that, if I had a chance, I should have died earlier rather than later. See, this is what my patients have been telling me in my clinics. So, that's my point of view. And this adding to what you just said. Over to you, Nilesh.
Yeah, definitely. I mean, the dilemma is there, whether you're going to value human lives or you're going to keep the economy afloat, because economies are crumbling. People definitely need to earn money, and the question is not an easy one for policymakers. But what actually meant when I said that people in Fiji are getting very complacent is because, if you go to supermarkets, for instance, you see people queuing up. They're not really following those physical distancing practices. The other day I was at the cashier, and then somebody was breathing right down my neck, and then even if you turn around and stare at people, they don't really get the message. So those are actually avoidable things. Of course, I'm not suggesting that people stop going to work or they stop interacting with others, and take all those drastic measures. But what I've seen is that people they have now started to do non-essential gatherings. They get together, they swipe drugs, they sit in close proximity. Nobody is observing. Most people are not observing some of those best practices that are out there. So that is something that I think all of us need to continue to emphasize. But the point that you have brought up, that's a very interesting point, no doubt. The fact that the need to balance between the human cost of the pandemic and the economic cost, and that is certainly a very difficult question for people to answer, and more so for a country like Fiji, which does not have that sort of an economic or fiscal capacity to be able to cushion such an economic shock. So we'd also like to invite questions or comments from others, please.
Thank you so much, Nilesh. Thank you for the presentation. I just wanted to ask this. W- Given what has transpired internationally about COVID-19, I'm just trying to, perhaps if the doctor could answer as well and just give just some analysis on this. We've heard a lot about the person that has COVID-19, but what about those that are sort of carriers of COVID-19 but are not showing the symptoms instantly? That's something, and and how and what will they be their impact to society, though they are not ones that are tested positive, but they're sort of carriers of COVID-19, but are slowly developing systems in the long run. So how can we determine between those two, the carrier and those that are positive? Thank you.
Yeah, in fact, I have talked about that, and that is one of the most problematic elements of this COVID-19, the way it spreads, and that is why it makes it so difficult to contain the pandemic. In fact, the best minds in the world have grappled with this question: how do you actually contain the spread of the virus? And that is why the best of the health systems globally have crumbled uh, under this particular with this pandemic. It is immensely difficult because there's no way, unless of course you test every single member of the population every day and isolate. And with the PCR tests, that again is quite a costly procedure. That means that you need to have enough labs, you need to have enough trained medical staff, you need to have enough kits to be able to test every member of the population for the COVID-19 virus every day. Because you don't really need to even come in contact with the infected people to contract the virus. You can actually come get the virus just by through fomites. Fomites are actually surfaces where bacteria is able to survive. Things like steel, plastic, hard surfaces, they are known to to be able to have the virus on them for up to 3 days. So that's a very long period of time. And so this is why it has become almost impossible to contain this particular uh, virus because of the way in which it is able to spread. In the case of the other coronaviruses, the SARS and MERS, um, the good thing was that people only were shedding the virus after they started giving symptoms, showing symptoms. So if you had MERS or if you had SARS, you would not be shedding the virus. You would not be transmitting it to others within the population until the time you started showing symptoms. But in the case of the COVID-19, that is not the case. You could be perfectly well, you would not have any idea you have the virus, but you could still be going around and giving it to other people. So that is what makes this particular virus so dangerous, because of the stealth with which it is able to spread. Anybody else has a question or comment to make? Fiji is one of the very interesting case scenarios, because in the case of some of the people that contracted the virus, and they did not observe quarantine procedures. They came into contact with a lot of people. I think in the case of um, the gentleman that came from India and went to Lambasa, he came in contact with more than 900 people. So the virus could have really spread because of the number of persons, and the outbreak could have been much worse. But very interestingly, there were very few cases of transmission, local transmission from that particular patient relatively. Maybe, the viral load that he had was low. That might be one of the explanations. Or maybe, the temperature and humidity levels actually played a hand in eliminating the virus, which is why he was not able to really, um, I mean, pass the infection on to a very large number of people. But thankfully that didn't happen. Otherwise, the epidemic would have truly got out of control in Fiji. But one of the areas in which we're lacking, and we cannot really emphasize that, overemphasize that, is the fact that we really don't have enough test kits. We don't have the testing ability. We have just carried out 1,300 tests, which is not enough by any measure to actually declare Fiji a COVID-19 country, and which is actually one of the reasons why Australia and New Zealand are perhaps not that confident about including Fiji in the tourism bubble, the trans-Tasman tourism bubble that they intend to create at some point in future. But I think, given the state of Fiji's economy, it is absolutely critical that Fiji needs to become part of that, because we need visitors coming in. We have a undiversified economy, right? And we have been relying too much on tourism, and that is now proving to be a real headache, you could say, for us. We have limited options as far as our economic expansion is concerned, and we are in a lot of trouble just because of the over reliance on a vulnerable sector of the economy. And I think that is a huge lesson that has been learned for Fiji. And in future, I think diversifying the economy will become a top priority of government. The agricultural sector has a lot of potential for growth in Fiji, particularly when it comes to import substitution. We import a lot of things that we eat from overseas, and that is costing us a lot in terms of foreign exchange, and perhaps in future that can be addressed. And I think the Fijian government is quite mindful of this, especially at this stage. But there has been decades of negligence of the agricultural sector. There have been a lot of problems also in Fiji. For instance, land tenure problems, which has prevented the growth of the agricultural sector to its potential. So hopefully that is going to happen. But I think at this stage, it is absolutely critical that that we need to continue to protect employments of people. So developing the agriculture sector, becoming self-sufficient in agriculture, is obviously going to take a certain period of time. We cannot hope to get immediate economic returns from agricultural expenditure. So immediate priority needs to be protecting employment of people, and that is what the government is trying to do. But as I've said, the government has a limited fiscal capacity to do it. They have recently started offering loans to small and medium enterprises. There are other quite well-to-do businesses which have taken the easier route. They have closed down and made a lot of their employees redundant, without jobs, with no household incomes. And that is very sad. But we also applaud the efforts of the other businesses that have been quite resilient in the face of disaster. They've continued operating, and they've continued to employ most of their employees, and even when they're sustaining losses, they're employing people, which is what most businesses ought to do. We have also done a research on the impact of COVID-19 on business activity and employment in Fiji, and we are going to be releasing this particular report maybe in by midweek. This is a survey that has been done, and it has got very interesting results on the impact of the pandemic on Fijian businesses. Okay, so any questions that you have? Tomorrow we'll be also having, the second part of this webinar, and that is going to happen from 10 a.m. Tomorrow is going to be a very interesting session in that we're going to have the president of the Fiji Law Society, Miss Laurel Baurasi, that would be joining us. And there's a lot of confusion about the application of laws and the legal fraternity itself appears to have different interpretations of the law. There have been magistrates and judges that have been giving very different and very a range of judgments and decisions on cases, especially relating to the curfew and other restrictions that have been brought about as a result of COVID-19. And interestingly, there have been quite significant clampdowns on freedom of expression. We have got politicians that have been charged and others. And it would be very interesting to get a legal perspective and also to engage all of you in a discussion on what are reasonable constraints on fundamental freedoms and liberties during states of emergencies and during a pandemic like this, because on one hand the imperative to contain the pandemic is certainly there, but on the other hand we need to continue to agitate for the protection of fundamental rights and liberties that are afforded in democracies, to see and to ensure that the state does not become unreasonable and too draconian in its application of laws. So any restraints, of course, need to be reasonable, and we need to continue to have discussions about what are reasonable constraints. So that is going to happen tomorrow. I'd also like to acknowledge the European Union for your funding support, which is making this webinar possible. And our partners, International IDEA, which is the lead implementing organization. Then we have others like the Citizens Constitutional Forum, the Pacific Center for Peace Building, and the Media Watch Group that are co-implementing the Fiji C3 project in association with the Dialogue Fiji. So again, we have about 5 minutes to go until the end of this session. So I'd like to take a final couple of questions before we round up the webinar for today. Yes, Sanjana. Yes, Sanjana. Oh, okay. So that was just a reaction from you. Broderick, you wanted to say something.
Nilesh, thank you so much for today. Maybe just some feedback from today's webinar. Yes. Again, if for tomorrow, because it's going to be a heavily digested topic, if we could just keep the participants' questions to be concise, just for the purposes of allowing the opportunity for other participants to get engaged in the conversations. I understand, of course, today was a bit of a slow, but I've actually wanted to emphasize that because I felt that there were other participants that are viewing this platform that wanted to ask questions, but couldn't because of the time frame for each speaker. And maybe perhaps, maybe a suggestion, maybe if for future webinars, it'd be important to also get feedback from grassroots communities and youth about how they've been impacted by COVID-19. I mean, and also for those, especially in the tourism industry, I think we all are aware what has just transpired during the call a few moments ago concerning some of one of the major tourism industries in terms of the COVID-19, and they're just currently dealing with unemployment now at this stage. So, just some ideas and thoughts for future webinars that Dialogue Fiji may be wanting to host, and just, engaging in these key groups of people. And, other than that, Nilesh, and to the team at Dialogue Fiji, thank you for a wonderful webinar, and look forward to what will happen tomorrow. So thank you.
Thank you very much, Broderick. Those were excellent suggestions and great feedback. We're going to certainly take those into account. In fact, this way of doing workshops and webinars is quite novel for us as well. I think this is the first time that we've tried it. So we had some budding problems, but in future we'll be able to refine our ways and be able to, make the experience better for the participants. But definitely great suggestions and taken on board. Anybody else has anything else to add before we round up today's session? Okay, it appears not. So that's it for the session today. And once again, reminding everybody that we'll be having the second part of this webinar tomorrow starting at 10 a.m. And we'll be joined by Ms. Laurel Morassi, the President of the Fiji Law Society. So we're hoping that all of you will be able to join us for the session tomorrow starting at 10 a.m. And we look forward to some very interesting discussions happening tomorrow as well. Very contentious issues, I know, likely to emerge tomorrow, but it is very important for everybody to engage on some of these issues. I know there are very few platforms for doing so, and we hope that tomorrow will prove to be one of those opportunities that would be useful to everybody that would be involved. So thank you once again very much. Thank you very much once again for everybody that joined us today, and we look forward to having every one of you again tomorrow. Pinaka.